Dear friends, as we all know that we are going through a very critical phase in our life, that we are facing the battle against the coronavirus, that is a COVID-19 disease has affected our day-to-day life. Now, here we have lot many things we have heard about, various precautions and various other things to be followed uh, for the COVID-19. Now, one more thing which is very important in the treatment and management of the COVID-19 is the impact of the disease on our mental health. Now, we have seen that lot many people are facing the problems of fear, anxiety, depression against the COVID-19, especially the geriatric patients, the aged patients, the healthcare workers, and there's a lot of concern in the public at large. Now, we have seen very escalated levels of anxiety and fear among the public. Now, we can categorize these people again into two categories. That is, one, those who are being suspected or those being infected by the coronavirus, and those people who are outside this and they are being kept in the lockdown positions. Now, the people who are being suspected or the infected, they have to be placed in quarantine or in isolations. So that means that person has to live in isolations all alone. So he has a feeling of loneliness, depression, fear and anxiety, which he has to face it all alone. Means he is not having anybody to share his feelings and thoughts with any other person except from the healthcare workers. And secondly, those people who are in the lockdown position, staying at home and obeying all the conditions laid down by the government, they have, and again they have a fear of anxiety and depressions because they have a very restricted movements in their own areas. And secondly, they have a restricted supply of their livelihoods and the items they need for the daily routine work. So in these two conditions, the people, they have a feeling of depression, anxiety and fears. And especially we have seen that in cases of patients who are being suspected or infected, they have fly away from the situations. And secondly, we have also seen some cases of suicidal tendency in these kinds of patients. So what we can do is that we have very simple solutions, although it differs from person to person, but we can adapt to them. Now again, certain guidelines they have been given by the World Health Organizations for maintaining the mental health of the patient or at the public at large. So one very important thing is that we can share our thoughts and feelings with any trustworthy person whom we feel like, that is our friends and relatives, maintaining the social distancing issues. Secondly, that can be done at any comfortable level. Secondly, we can also practice either yoga, the meditations, any light exercises, whatever you feel like. Then one can go to the music or any other thing which suits a patient mind or person's mind. Then another problem arises with the public people who are alcoholic or who are chain smokers, because they are being deprived of these things in a lockdown positions or when they are being placed in quarantine and isolations, because that affects their health. So for that, they can call the healthcare workers and then they can get some advices from these people and act accordingly. And one very important thing is that one should have a positive mind and one should go for the positive thinking, because that is going to affect their health and then that can help in the management of the disease. Then lastly, the patience. Patience is very important, because whatever it is a phase and we will definitely come over it. So lastly, what I want to say is that this is a battle which is of very different kind of nature, but all together maintaining the social distances, all following the guidelines of our government and WHO, we can overcome this and we can again revive back. Thank you.